Once again, you're on MSNBC. We were so delighted to finally have a health care program where everyone will be covered and everyone will be disease-free and have free everything. And this is wonderful. And now, it looks like to me, if you're elected president, we won't have any health care at all. Would you explain what on earth you're going to do? And we're going to begin with Mr. Keller.
Didn't the Supreme Court just do a lot of arguing about that being unconstitutional to begin with? And did health care actually improve for anybody? I don't think so. But my position on health care, as well as just about any of these things that are not constitutionally mandated responsibilities for the federal government, is to let the local level handle it and let the private sector handle it. And I just was watching something on, I think it was on CNN last night. I don't remember which channel it was, but they were comparing our healthcare system, the government-run healthcare system, and the private healthcare system, and they were showing that the treatments done in the private sector were much more cost-effective, and they were more effective. People were getting cured faster and better than with the government system. So that proves that we shouldn't be going down the federal system path. So that's it.
Mr. Wright.
You know, P.J. O'Rourke said that if you think health care is expensive now, just wait till it's free. He's right. The way that the government makes it free is by regulating it, telling everybody what to do, which adds cost for your doctor visits, for your treatments, for everything. Let's think about government for a minute, government agencies. We're talking about a body of people that can't protect you when you're at the local mall and you're able-bodied. Why would we trust these same individuals to take care of us when we're sick and can't take care of ourselves? There is no incentive for them to do a good job. There's only incentive in them for money and making it cost as little as possible to keep you alive as long as they feel like it's necessary. Nobody should be involved in your health care decisions besides you and your doctor. Not a bureaucrat, not a politician, not an agency, not a group, nobody. You and your doctor, that's it. Get government out of the way and you'll be able to afford your own health care.
Mr. Steele.
I just got an email about 4 days ago, and I'm so sorry I don't have that email here to quote some of the unbelievable things that are in this health care bill. I believe it's on page 252, for example. Do you know that at age 76, if Obama's health care bill holds Supreme Court scrutiny, that it will not allow payments for chemotherapy or advanced cancer treatments after age 76? This lady's shaking her head. I believe you're in the medical community, aren't you? There are things in that bill that are just unbelievable. The Obama health care bill has got to go. Actually, the way we've got it today is not incredibly bad. I mean, if you really are destitute, you're still treated in an ER. We don't have such a bad system. It definitely needs to be tweaked, but the Obama bill is just, you aren't going to believe it when you actually start feeling the effects.
Mr. Harris.
I mean, who out there thinks that a glance at the last 100 years of failed progressive socialism at the federal level is somehow going to magically change with this health care bill? I mean, we've seen it time and time again. The federal government is completely incompetent to deliver individual, private, and social welfares. So if you really do care about the health care needs or the poverty needs or any of these other social needs out there, then the most obvious thing to do is to get the federal government out of it, because they've proven with more than a century of incompetence that they can't handle it. And as it applies to healthcare, just look at the VA hospitals. Look how they're run and ask yourself if you would want to be a patient there, if you would want to have to go to an all-government hospital. And I suspect that the answer for most of you is no. Now, I also agree, though, or I believe that as president, the president has a lot of power to stop this. Article 2 of the Constitution says that the president has to take an oath to preserve and protect and defend the Constitution of the United States, and that's over and above regular legislation that's passed by the Congress, which is why, as president, I will not enforce Obamacare.
Mr. Pearson.
Medical care is really no more than another war on, this case, sickness. It's just not given that name, but it's just one more war that the government has created. It's a boondoggle. Take education. 5% of the cost of going to college is really all that it costs to get the education. $19 out of $20 is spent wastedly for regulation. I think there's a great degree of that in the medical care situation. Let us give the medical situation back to the doctors, let them own their own practices instead of working for the insurance carriers. Let them own their own practice, let us have more care at the local level, and we can solve this problem locally.
Mr. Johnson.
I'm promising to submit a balanced budget to Congress in the year 2013. That will detail a 43% reduction in Medicaid and Medicare. And before anybody falls off their chair with regard to a 43% reduction in either of those categories, it's important to point out that if we don't balance the federal budget, we're going to find ourselves without any health care at all. So as governor of New Mexico, I oversaw the reform of Medicaid in New Mexico, health care to the poor, changed it from a fee-for-service model to a managed care model, set up better health care networks, saved hundreds of millions of dollars. I believe at the time that if the federal government were to have block granted the state of New Mexico 43% less money, done away with all the strings and the mandates, that I could have effectively overseen the delivery of health care to the poor in New Mexico. I think the same model applies to Medicare. 50 laboratories of innovation and best practice. The federal government has to give it up to the states.